Good evening. I'm Dr. Sayyed Amjad, Interventional Cardiologist from Solapur, the owner of a Noble Hospital, Solapur. So today we'll be discussing about the hypertension, a part of hypertension which is very essential to know and which will affect the treatment modality. Sympathetic overdrive in hypertension. If you see the characteristics of essential hypertension, the most commonly few features are there which are directly linked to the treatment. The most common part, the type of hypertension, the essential hypertension, wherein the cause is not very sure. There are a lot of postulations, and a large number of percentage of patients will have marked sympathetic overdrive or impaired parasympathetic tone that results in increasing heart rate and other parameters. So, what is the influence of sympathetic overdrive in circulatory system? If you see, if there is a sympathetic overdrive, the increase in heart rate and there is increase in cardiac output. Because of that, peripheral vascular resistance is increased, sodium reabsorption in the kidneys increase cardiovascular risk, and high evaporative values, platelet aggregabilities increase, and elevation of systemic blood and cardiac output. So we need to identify the subset of patients in which there is a sympathetic overdrive is present, and it is present in most of the cases. So what are the deleterious effect of sympathetic overdrive? So if you see the whenever there is a heightened sympathetic outflow, the vascular effects, cardiac effects, renal effects, and metabolic effect and immune effect. If you see the vascular effects, the smooth muscle cells proliferation and hypertrophy happens. There is medial thickening and endothelial dysfunction, increased arterial stiffness and peripheral vascular resistance. This all lead to ultimately the rate of increase in atherosclerosis process. That leads to cardiac and different vascular events. Similarly, in cardiac, the cardiac myocyte hypertrophy, left ventricular hypertrophy, and increased incidence of cardiac arrhythmias like tachycardias. So such patients are increased at the risk of sudden cardiac death because of tachyarrhythmias whenever there is a muscle hypertrophy, and that is secondary to sympathetic outflow increased. The renal effects will be again renal vasoconstriction, sodium and fluid retention. That again begins, and that again vicious cycle which leads to increase in hypertension because of sodium retention and fluid retention, glomerulosclerosis and microalbuminuria, which ultimately might progress to chronic renal disease and they might go on dialysis and other issues. So metabolic effect, sometime it is a part of the metabolic syndrome. Like these patients with increased sympathetic tone will have more insulin resistance, increased plasma insulin levels, and dyslipidemias. That ultimately these all factors leads to again increase and heighten the rate of atherosclerosis, which is the normal process, which will be very fast in these patients. Immune effects, nowadays we are more concerned about immunity because of other infection and inflammations. The immune system like inflammation, leukocyte activation, extravasation, vesication, and oxidative stress, cytokines and chemokines is all is influenced by sympathetic overflow, and that all leads to the decrease in immune response. So sympathetic overdrive and hypertension, if in Indian scenario, if you see 6 out of 10 newly diagnosed hypertensive patients in India have sympathetic overdrive. That is 62% almost prevalence. The restlessness, inappropriate sweating, tremors in hands were found to be the most prevalent symptoms of sympathetic overdrive in hypertensive patients. There was a statistically significant correlation between sympathetic outflow increase and heart rate. That is very significant. In that particular study in India, they have done, which published in the Indian Hypertension Journal. They have said that the very significant p-value. The majority of the patients with sympathetic overdrive were obese. Almost 40 to 50% patients were obese.